and welcome to today's session. Our theme today is Yes, I Can. Yes, I can detect cancer early. Yes, I can survive cancer. As you all know, women today are multifaceted. We all take care of our families along with our aspirations. Yet, health does take a toll on us at times. For this International Women's Day, we bring you in depth discussions with some of the best oncologists, pathologists, geneticists, genetic counselors, and survivors to debunk some of the myths regarding human cancers and its management. Today, we have with us Dr. Bhooshan Zade. He is Director Radiation Oncology from Ruby Hall Clinic, Pune. Thank you, Dr. Zade, for joining us on the call.
So you might
Thank you. We have your questions to debunk some of the myths on radiation oncology during a cancer treatment. One of my first questions is radiation oncology radiation given to a lactating mother?
Yeah, before we start about this radiation therapy, how safe it is in lactating females, let me have a few words about what is radiation exactly. To this topic. So radiation oncology is a branch of oncology which uses high energy X-rays to treat a cancer. Let us not go into details, but it's a simple explanation that one should know what is radiation oncology. So in females who are lactating, there can be two situations. Like we are treating in a breast cancer, a female with a breast cancer who is lactating. The other situation is we are treating any other cancer apart from breast cancer in a patient or in a mother who is lactating. So let us talk about first situation. So in first situation, the lactating mother is planned for radiation to one breast who has got a disease. Surgery has been done, chemotherapy is done, and now she is due for radiation. So radiation therapy will not stop. It's not a contraindication for lactation that one should not feed our baby. It's not like that. Only thing is the affected breast because of radiation may produce a little less quantity of milk because of some drying up of the milk secreting glands. Quantity may be less, but there is no contraindication. Secondly, the other breast, which is a normal breast, which is not getting radiation, which is not being handled with surgery, is secreting adequate quantity of milk, so that is always available for a child. This is one situation. The other situation, that suppose the lactating mother is getting radiation to some brain area or head and neck cancer or say pelvic cancer, then it's absolutely safe for her to feed her child. There is no such situation that during radiation she cannot feed. I think it has answered your question.
Yes, it does. Thank you so much. My next question is, are there any tips on skincare on the affected area where the radiation is given?
Yeah. So we need to understand what kind of a skin side effects usually happens during radiation. So typically radiation therapy is like, suppose since we are talking about the context of International Women's Day, let's talk about breast cancer. Anyway, breast cancer is very common cancer in India and it's increasing. We are just following the Western trends and it's becoming #1 cancer in women. So traditionally, breast cancer radiation therapy goes for 5 to 6 weeks. Now there are newer protocols in which we can reduce this number of fraction by increasing dose per fraction, and we can complete this 5 to 6 weeks treatment into 3 to 4 weeks. And there are even newer protocols like fast forward protocols or fast protocols in which we try to complete radiation in 1.5 weeks. So whatever protocol we may choose, there could be some different set of or severity or timeline of side effects, but side effects are more or less same. And let us talk about skin side effects you are asking me. What happens in first week or second week of radiation, there might be little reddish discoloration of the affected skin, which may goes into little higher reddishness or little darkish discoloration. There could be some disquamation. Disquamation means little peeling of like it happens in like winter season. It is peeling of the skin of affected area. That may happen in a very rare situation. There could be a moist disquamation. Now, what is moist disquamation? The disquamated area becomes little moist, sweaty kind of a thing. It irritates. So that can happen, but that is very rare. Typically, it happens when there is an injury to the skin, like while taking bath or while dressing, there is unknowingly that area gets some kind of a scratch thing, and then that fragile skin gets peeled off, and that area gets denuded, and there is some moist discoloration thing, which is again simple. You have to just keep it dry and keep it clean, and it heals in a week or 10 days time. That's not a problem. But the thing is, if you take good precaution, that a good counseling by a doctor to a patient, that she has to take these kind of precaution. Yes, she can take a shower, she can take bath, she can do cleaning, but it should be gently done. There is no harsh. Do not rub it dry, just pat it dry. Simple kind of a modification in your daily lifestyle will reduce a kind of incidence of discomfort to a lady. And these side effects, mild skin rash or say redness, will automatically heal in a week or 10 days time, or at the most in a month's time. And any other skin changes which is happening apart from the radiation area is not at all related to the radiation. Sometimes it happens that something is going on somewhere else in body, and we label that it is because of radiation, because radiation is going on. It is not like that. Radiation is a local treatment, so whatever happens in that area is because of radiation. Anything happening other than that area is purely something else is happening. So we need to take care accordingly.
Perfect. Thank you. That was really new for us to learn, because sometimes we feel all the skin changes or something is because of the treatment that the patient is
there are common misconceptions. These are not that way. Only radiation per se, by definition, local treatment. It doesn't affect other parts of the body.
And we come to our last question, Dr. Zade. Is there any other message for us women on this International Women's Day?
So first, congratulations on this year's International Women's Day, and I hope, and you women, females, they are very strong. It's just a kind of a we think that you should need support or courage. I don't see any reason of thinking that way. So it's just awareness. More awareness will bring more good in you. Early diagnosis, better treatment, newer treatments are reducing side effects and increasing cure rates. So I think just come forward and see a clinician if you feel something is wrong. Do not hide just because you are shy or there are no resources, or because it will many times we get a lot of advanced cancers or a lot of bad situation because of the very fact that the symptom has started some 6 months back, and just because how to come forward or how to whom to should share this kind of information. That kind of a situation creates lots of advanced cases of cancer, and then everything becomes difficult. So my only message is come forward, talk to people, concerned people, and things will be simple.
Thank you so much for your personal. Thank you for listening.